Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, let me introduce myself. My name is Halimatussya'diyah. I'm from class 3B, English Department, Sultan Ageng Tirtayasa University. My study number is 22232000014. I asked the first speakers previously. I also brought 4 of my friends. They are Hanna Silviana as the second presenter, Sofyan Arief as the third speakers, Dewista Rezka Ayu as the fourth speakers, and Hanif Amar Muzakki as the 5 speakers. I will explain about the Covid-19 vaccine, about the type of vaccine and their function, benefit and side effect of vaccine requirements, and news about vaccine today. Okay, before moving on the next discussion, I will explain a little about vaccine. Is the COVID-19 vaccine a drug? Here's the explanation. The COVID-19 vaccine is not a cure. Vaccines are given to healthy people to prevent certain diseases from infecting that person. The COVID-19 vaccine is a form of prevention that functions to encourage the formation of specific immunity to COVID-19 disease to avoid contracting or possibly becoming seriously. The COVID vaccine is one of the efforts of the Indonesian government in dealing with the COVID-19 problem. The COVID-19 vaccination aims to create groups immunity so that people become more productive in carrying out daily activities. COVID-19 vaccination in Indonesia is currently entering the second stage of vaccination. Is advantageous for groups of people who have high mobility so that the potential for exposure to COVID-19 is very high or challenge public works. What are the ingredients in vaccine? Vaccine contains the fragment of disease-causing organism or a blueprint for making two tiny fragments. Vaccine also contain other ingredients that maintain the safety and effectiveness of the vaccine. Other ingredients have been incorporated into vaccine and have been used for decades in billions of vaccine doses. Each component of the vaccine has a specific purpose, and each ingredient is tested in the manufacturing process. Safety tests and run on all materials. The first is antigen. The main ingredient in vaccine is an antigen. An antigen can be either a small part of a disease-causing organism or almost attenuated version. So, your body can learn a specific way to fight off the antigen without getting sick. The second is preservative. Preservative prevent the vaccine from becoming contaminated once the envelope is open, if it will be used to vaccine more than one person. This preservative has been used for many years in a number of vaccines. It's used in some baby care products and is safe for use in vaccine as it is almost non-toxic to humans. The third is stabilizer. Stabilizer prevents chemical reaction in vaccine and keep vaccine component from sticking to vaccine employees. The fourth is surfactant. Surfactant prevents the preventation and agglomeration of elements present in liquid vaccine. The fifth, residue. Residue are small amounts of various substances used during the manufacture or production of vaccine that are not the active ingredients in the finished vaccine. The sixth is solvent. The solvent is the liquid used to dissolve the vaccine to the appropriate concentrate ion before use. The solvent most often used is sterile water. The seventh is adjuvant. Adjuvant increases the immune response to vaccine, sometimes by keeping the vaccine in the right location for a slightly longer time or by stimulating local immune cells. Yes, those are the ingredients in the vaccine. Alright, then there will be an explanation of the type of vaccine and their uses.
Type of vaccine. Sinovac COVID-19 vaccine is the first vaccine used in Indonesia. However, currently there are various types of COVID-19 vaccine that are used for the national vaccination program. The COVID-19 vaccination program is increasingly being implemented. The government strikes the COVID-19 vaccination program for 208 million people. For the implementation of the COVID-19 vaccination, the government has set a number of vaccines. The Food and Drug Supervisory Agency (BPOM) has issued an emergency use authorization (EUA) for 5 COVID-19 vaccines in Indonesia since January 2021 until now. The 5 vaccines that have received EUA from BPOM are Sinovac, AstraZeneca, Moderna, Pfizer, Sinopharm. Each type of COVID-19 vaccine has its own characters, such as the number of doses at the interval of administration. In addition, the COVID-19 vaccine platform is also different. Some are developed from inactivated virus, RNA-based viral vector, and protein subunits. However, all of them have been confirmed to be safe and effective in preventing the COVID-19 virus. The first that are Sinovac's COVID-19 vaccine from Sinovac. This COVID-19 vaccine from a Chinese company is the first to be available in Indonesia. The Sinovac COVID-19 vaccine was developed from an inactivated virus and is administered intramuscularly. Each person gets 2 doses of the COVID-19 vaccine, and each dose is given at 28-day intervals. The Sinovac COVID-19 vaccine was given in the first various vaccination programs launched by the government. The Sinovac COVID-19 vaccine is also declared safe for children, especially children aged 12 to 18 years. COVID-19 vaccine. The second, AstraZeneca. AstraZeneca COVID-19 vaccine has a platform. Is the form of a viral vector non-replication and is given in 2 doses. AstraZeneca COVID-19 vaccine is administered at the longest intervals compared to other vaccines in Indonesia, up to 12 weeks. AstraZeneca COVID-19 vaccine has received EUA from the Food and Drug Supervisory Agency (BPOM) of February 22, 2021. In addition, AstraZeneca COVID-19 vaccine is also claimed to be effective against the Delta and Kappa variants of the coronavirus. Sinopharm COVID-19 vaccine. The Sinopharm COVID-19 vaccine has also received an emergency use permit for use in Indonesia. The Sinopharm COVID-19 vaccine is produced by a Chinese pharmaceutical company with similar character to Sinovac's, including in terms of the platform and the number of doses. Citing the website of the University of Gadjah Mada or UGM, according to Professor Zulis Ikhwadi, PhD from the UGM Faculty of Pharmacy, the Sinopharm COVID-19 vaccine has efficacy of 78%. Sinopharm COVID-19 vaccine, he said, could also be used in the population aged 18 years and over. The third, Sinopharm, was proposed to be a mutual comparison vaccine can be obtained for a fee from the Kimia Pharma network. However, this is temporarily cancelled by the government until further notice. Moderna COVID-19 vaccine. The Moderna COVID-19 vaccine is messenger RNA-based vaccine that was first used in Indonesia. Moderna COVID-19 vaccine does not use an attitude virus but use components of engineered genetic material. The fourth, Moderna. Products by Moderna Incorporation is claimed to be effective against the Delta, Kappa, and Gamma variants. In addition, the modern COVID-19 vaccine is considered safe for people with comorbidities. A total of 3 million doses of the Moderna COVID-19 vaccine by the United States arrived in Indonesia on July 11. The government has determined that the Moderna COVID-19 vaccine will be prioritized for healthy work as a third-stage booster vaccination. And the last, Pfizer. Pfizer COVID vaccine is RNA-based vaccine and is most widely used in the US and Europe. The effectiveness of Pfizer COVID-19 vaccine is considered too high that it was in great demand by various countries in the world. Pfizer COVID-19 vaccine is giving a similar dose, but it takes 2 stages of the vaccine to get protection from the vaccine, which is said to be effective against these Delta variants. Indonesia has just signed the provision of 50 million doses of the COVID-19 vaccine for the whole year 2021. This is considered to be able to assist the implementation of the vaccination program for the entire community.
Hello, my name is Mohamad Sofyan Arief, and right now I'm gonna explain about how does vaccine work and the side effect after we got a vaccine. So the body has many ways of defending itself against pathogens or disease-causing organisms. Skin, mucus, and cilia is a microscopic hairs that move debris away from the lungs. All work as physical barriers to prevent pathogen from entering the body in the first place. When a pathogen does infect the body, our body's defense, called the immune systems, are triggered, and the pathogen is attacked and destroyed or overcome. A pathogen is a bacterium, virus, parasite, or fungus that can cause disease within the body. Each pathogen is made of several subparts, usually unique to the specific pathogen and the disease it causes. The subpart of a pathogen that causes the formation of antibodies is called an antigen. The antibodies produced in response to the pathogen's antigen are an important part of the immune system. You can consider antibodies as the soldier of your body's defense system. Each antibody or soldier in our system is trained to recognize one specific antigen. We have thousands of different antibodies in our bodies. When the human body is exposed to an antigen for the first time, it takes a time for the immune system to respond and produce antibodies specific to that antigen. So I got image here. There are 4 viruses. 3 of them is measles, chickenpox, and flu, and the last is a new virus. When a new pathogen or disease enter our body, it introduces a new antigen. For every new antigen, our body needs to build a specific antibody that grab onto the antigen and defeat the pathogen. Vaccines contain weakened or inactive parts of a particular organism or antigen that triggers an immune response within the body. This weakened version will not cause the disease in the person that receiving the vaccine, but it will prompt their immune system to respond much as it would have on its first reaction to the actual pathogen. So I got another image here. As you can see, a vaccine is a tiny weakened non-dangerous fragment of the organism and includes part of the antigen. It's enough that our body can learn to build a specific antibody. Then if the body encounters the real antigen later as a part of the real organism, it already know how to defeat it. Some vaccines require multiple doses, given weeks or months apart. This is sometimes needed to allow for the production of long-lived antibodies and development of memory cells. In this way, the body is trained to fight the specific disease-causing organism, building up memory of the pathogen so as to rapidly fight it when exposed in the future. Next, I'm gonna talk about side effect after we got vaccine. COVID-19 vaccination will help protect you from getting COVID-19. You may have some side effects which are normal signs that your body is building protection. These side effects may affect your ability to do daily activities, but they should go away in few days. Some people have no side effects. There are 3 common side effects after we got vaccine. So there are 2 side effects after we got vaccine. The first is the effect on the arm that you get shot. The side effects are pain, redness, and swelling. And the second side effect that affect your whole body. There are 6 of them. The first is tiredness, second headache, third muscle pain, fourth chills, fifth fever, and the last is nausea. Talk to your doctor about taking over the counter medicine such as ibuprofen, acetaminophen, aspirin for any pain that discomfort you may experience after get vaccinated. It is not recommended if you take this medicine before vaccination for the purpose of trying to prevent side effects. Here I got helpful tips to relieve the side effect of vaccine. The first, to reduce pain and discomfort where you get shot. You can apply clean, cold, wet washcloth over the area and use or exercise your arm. But remember, just a light exercise. Next, to reduce discomfort from fever, you have to drink plenty of fluids, rest lightly, and get rest. When a lot of people in a community are vaccinated, the pathogen has a hard time circulating because most of people in encounters are immune. So the more that the others are vaccinated, the less likely people who are unable to be protected by vaccines are at risk of being exposed to harmful pathogens. This is called herd immunity. So why don't we get our vaccines as soon as possible to protect ourselves, people around us, and the world? That's it from me. Thank you for your attention. To the next speaker, please.
Next, I will tell you about the vaccine requirements in Indonesia. Maybe many people don't know it, and there are also many hoax news circulating about vaccine requirements. Before getting vaccinated, we should know in advance what the conditions are. This is done to avoid unwanted side effects. What are the requirements that must be met before the vaccine? The following are the requirements that need to be considered before receiving the COVID-19 vaccine in Indonesia. First, having chronic diseases such as heart disease, autoimmune, chronic kidney failure, autoimmune rheumatism, chronic digestive tract disease, hyperthyroidism or hypothyroidism, and also cancer. Second, not currently experiencing an acute infection accompanied by fever, cough, runny nose, diarrhea, and others. Third, the requirements for the COVID vaccine for the pregnant woman is to carry out a screening process. Only applies to pregnant women whose gestational age is 13 weeks and is in the second trimesters of pregnancy. 4. Don't have family members who are COVID-19 patients or are being treated for COVID-19.
Fifth, if during health screening you have a fever or body temperature is above 37.5 degrees Celsius, the vaccination will be postponed. Then they will be asked to do an examination related to the symptoms experienced and visit the same health post. If the cause is not COVID-19 and the temperature has returned to normal, then vaccination can be done by screening first. 6. People with control type 2 diabetes and an HbA1c below 58 mmol per mol or 7.5% can be vaccinated against COVID-19. 7. If you have a lung disease such as asthma, COPD, or tuberculosis, the vaccination will be postponed until your condition can be declared good. 8. For people with tuberculosis who are still being treated, vaccination can be given 2 weeks after receiving anti-tuberculosis drugs. 9. If during the health screening you have blood pressures above or equal to 180 per 110, it means that the vaccinations cannot be given. 10. If the patient has a history of severe allergies or has symptoms of shortness of breath, swelling throughout the body after being vaccinated against COVID-19 previously, then the second dose of vaccination will not be given again. 11. If the patient received other vaccination other than the COVID-19 vaccine in less than 1 month, the vaccination is postponed until 1 month after the previous vaccination. And the last is, survivors of COVID-19 can get vaccinated at least 3 months after recovering. Those are some of the vaccine requirements in Indonesia. This requirement is stated in the decree of the Director General of Disease Prevention and Control regarding technical instruction for the implementation of vaccination in the context of combating the 2019 coronavirus disease or COVID-19 pandemic. So we don't need to hesitate anymore to vaccinate so that our immune system will form antibodies against the coronavirus. And also don't be easily influenced by the news about the COVID vaccine requirements that are not true. For people who want to be vaccinated, of course they can immediately register at the nearest vaccination post according to their respective regions.
Reporting to you by Hanif Amar Muzakki, today I will be sharing you a few information and news about COVID-19 vaccines that are occurring today in Indonesia, of course. Jakarta, September 19th, Indonesia is in talks with the World Health Organization (WHO) as well as 6 drug companies to become a global hub for manufacturing vaccines. Its health minister told Reuters, detailing the ambitious strategy for the first time. Budi Gunadi Sadikin said in an interview that Indonesia would kickstart the initiative by prioritizing purchases of COVID-19 vaccines from other companies. That, of course, that company has to share the technology and set up facilities in Indonesia. We are working with the WHO to be one of the most global manufacturing companies hubs for mRNA, he said, adding he had directly lobbied WHO Director General Tedros Adhanom Ghebreyesus on a trip earlier this month to Europe. The WHO has pointed to South Africa as the first location, and I said that logically, Indonesia should be the second. The new technology transfer hubs are part of a WHO strategy to more widely distribute vaccine productions. Of course, globally, and build capacity has to be in developing countries to make new generation vaccines like Moderna, mRNA, and Pfizer's BFAN. Nucleic acid-based mRNA jabs, which can be quickly adapted to handle new virus variants. Efforts to develop a base for COVID-19 vaccine productions in South Africa will focus on trying to replicate Moderna's shot. But a lack of progress in talks with the US company means the project will take a lot of time. A senior WHO official told Reuters. Budi said Indonesia was keen to build expertise in mRNA vaccines as well as viral vector shots, such as those produced by AstraZeneca or ASEAN.L. A WHO spokesperson said Indonesia was one of the 25 low and middle income countries to express interest in hosting a vaccine hub, but declined to say if it was a leading candidate. Budi said Indonesia was well placed to export vaccines around the world, especially as it is the world's most populous Muslim majority, and could guarantee that its jabs were halal, or permissible according to Islam. Indonesia has grappled with one of the most severe outbreaks of COVID-19 in Asia and has recorded more than 4.1 million infections and 139,000 deaths, although public health experts say the true figures are likely several times higher. Indonesia's rate of infection and deaths has declined sharply in recent weeks, but with only 25% of its target population of 208 million, people fully inoculated against COVID-19 still has a major vaccination effort ahead, especially as it is likely to have to provide third booster shots. Budi said Indonesian pharmaceutical companies are in discussions with vaccine manufacturers and, of course, the developers Anhui Walvax, Sinovac Genzyme, and Arcturus Therapeutics and Novavax. The talks range from basic fill and finish to upstream production and research and development, he added. We open the same opportunities also to AstraZeneca. We are also open to the same opportunity to the existing partner Pfizer, he said. We are obviously open to anyone. Bambang Herianto, Corporate Secretary of Bio Farma, Indonesia's largest state-owned drug company, confirmed the talks were on and the first step was to collaborate on the transfer of technology. It would take 2 or 3 years to build a fully operational production facility, he said. Budi said Indonesia would use its leadership of the G20 group of countries starting in December to promote global health security and prepare for the next pandemic after the coronavirus, also known as SARS-CoV-2. No one can guarantee that SARS-CoV-3 and 4 will not come. So therefore, we must be cautious every time there's a new deadly attack or virus that's coming our way. Reporting by Hanif, Amar, Muzakki. Thank you, viewers, for listening, and have a good day.